Okay, this is my presentation on accumulation disorder, which is also called hoarding, by Alyssa Marsh. So the description of the population, according to the Mayo Clinic, the definition of hoarding is a persistent difficulty discarding or parting with possessions because of a perceived need to save them. A person with a hoarding disorder experiences distress at the thought of getting rid of items. If they're confronted about it and they need to throw things away, they are very upset. They're emotionally tied to these items and they're unable and unwilling to get rid of them. Excessive accumulation occurs regardless of the value. Sometimes people can mix up collecting with hoarding. A collector collects specific items that they think are valuable, and that is not what this is. Hoarding is, it can be anything that they hoard, and it's usually a variety of things. But hoarding, takes up their living quarters, and they just have a bunch of things. This is a vulnerable population because often they don't want to get help because their things make them happy and they make them feel safe, and they often don't see a problem with what they're doing. Or on the flip side, they keep, their living quarters private, and so they don't talk about it. So the size of population, this population is hard to find exact numbers. It's estimated that 2 to 6% of the population has a hoarding problem, and that's from the American Psychiatric Association. Some things I did find were it's more common in males and females, and it's more common in the older adult population, ages 55 to 94. There is a younger population that can deal with it, but with hoarding, but it's 3 times more likely as you're older. Again, you're not sure of these statistics because a lot of people with a hoarding problem keep it private and they don't want to seek help. And then there's a range with hoarding. There can be mild hoarding to severe, which severe hoarding often involves animals, an unsanitary living condition, their houses can be condemned, and so forth. So the contributing factors are, the social determinants of health that are barriers for people with hoarding disorder are safe housing. Again, they have so many things in their house. It depends on the person. They can be living in filth, and that can affect their health. It can affect their safety, right? There's fire hazards and fall risks and tripping hazards. Another social determinant is social support. They generally don't feel like they have support because people don't understand this problem and they're not supportive of all of these things in their house. And then with social norms and attitudes, hoarders tend to be more quiet, lonely people who don't have this normal, social environment. Specific concerns, hoarding is recognized as a psych disorder. One of the biggest concerns with hoarding is that the individual doesn't recognize this as a problem, so it makes treatment very challenging. And then, like I said, hoarding animals causes an unsanitary and unsafe living quarters, putting the health of the individual at risk. And I'll talk about that more in just a minute. So root causes, it's not clear what causes hoarding, but according to the Mayo Clinic, they are studying genetics, brain functioning, and stressful life events as being possible causes. With genetics, there is a tie with family history. So if someone in your family has a hoarding problem, it's more likely that you will have one too. Brain functioning, hoarding is associated with OCD, anxiety, depression, those kind of issues. And then with stressful life events, something can happen to cause a stressful life event can cause a person to hoard. It all depends on how people deal with their stress. It did also say, the Mayo Clinic did also say that an indecisive personality can lead to hoarding. Yes, and this population, again, is vulnerable because they live in a very cluttered environment, but it can also be toxic, and them not seeking appropriate help makes them vulnerable. If hoarding is severe enough, like especially with animals, people who tend to hoard animals live in very unsanitary conditions. If the animal has died and they don't know about that, or if the animals just go to the bathroom all over the house, it can eventually lead to their house being condemned, and then they don't have anywhere to live. So the Maslow's hierarchy of needs, normally their physiological needs are met, right? They still have somewhere to live, they're eating and drinking. Those basic needs for the most part are met, but everything else is not met. Their safety, because of their house environment, their safety isn't met because they're living in chaos and they have all these things everywhere. And if they animal hoard, then that poses a risk to their health safety. The love and belonging. People with hoarding disorder tend to be lonely, or they isolate themselves because those around them don't understand, and so they tend to just isolate. The esteem, their self-esteem, because people who don't understand, again, they tend to isolate. And then the self-actualization, they don't have that because they're unwilling to fix this problem, or they're unaware of their problem. Their functioning levels vary depending on how severe hoarding is, and likely health outcomes. Like I said earlier, hoarding is associated with depression, anxiety, OCD, and ADHD, and then their health outcomes with safety issues in their home. So communicable diseases or infection. All this information is from the Tufts website, but they can live in a toxic environment due to the animal feces and urine and just the uncleanliness that often is associated with animal hoarding. The ammonia levels can be very high. Zoonotic diseases are diseases that come from animal to people, so often people with animal hoarding specifically will get those kind of diseases. And then this syndrome is just from living in unsanitary living conditions, which is way more than just an unclean environment. It's unsanitary. It is not safe. And then the non-communicable disease or infection is just those infections I just talked about that are caused by hoarding. So specific concerns with their self-care, self-harm. This population tends to not take care of themselves in the way that they are lonely and they isolate. If their hoarding is severe, then they're living in an unsafe environment, so they're often, not getting that social interaction that they need. Maybe they're physically not keeping up with their needs. They just tend to really be lonely people. The risk for harm for themselves is that injury, an increased risk of falls from all the things that are around their house, fire hazards from everything, the unsanitary living conditions. Again, that comes back usually to if they hoard animals. And then they're not really at risk to cause harm to others, except if it becomes, if their house becomes so toxic, then that can spread to neighbors, and that can make their living situation unsafe. And then that's when they can pose risk to others, if that gets out of control enough. But just themselves, people who are hoarders are generally not a risk to others. And then those are all the references. Okay, thank you.